Welcome to Alt Health. There are many paths to healing, and Alt Health explores them all. Hi, welcome everyone. Welcome to Alt Health. I'm your host Sadaf, and this webinar is for curious health enthusiasts who want to dive into what's beyond mainstream medicine and become gurus of their own wellness journey. Today we have with us Dr. Ameed Murad, a medical doctor who carries with him half a millennia of Unani legacy. Dr. Murad has also studied functional medicine and combines his knowledge and expertise from various disciplines to customize medicine for his patients. He has pioneered a program which integrates allopathy with ancient Unani Greek medicine to give miraculous results to his patients. Welcome, Dr. Murad, and thank you for joining us and giving of your time and knowledge so generously.
Thank you. Thank you for the welcome.
Before we begin, I just want to attend to some housekeeping matters for our participants. So participants feel free to ask questions at any time during the webinar. There's like a little there's like a black bar there should be a black bar at the bottom of your screen, and it'll say Q&A. So pop your questions in the Q&A section, and we'll try to get to it throughout the webinar as much as possible. So when Dr. Murad comes to a particular topic, we'll try and cover your question during that topic. And also feel free to use the emojis to communicate how you feel about the topics we're discussing. It'll give us real-time feedback and allow us to continue on if everybody's interested in a particular topic, or maybe cut it short if not so many people are interested. And above all, I guess, have fun and enjoy the content. Thank you, Dr. Murad. I want to start by asking you a little bit about your background. What's very interesting about you is that you're a medical doctor, you have a background in Unani, and you studied functional medicine. Functional medicine is becoming quite popular and growing in its use these days, but I'm yet to see somebody who combines Unani with functional medicine
and allopathy.
Yeah, allopathy. Yes, yeah. So I'll let you begin. Yeah.
So hi everybody, welcome, good evening, and assalamu alaikum. Anyway, as Ms. Sadaf has given a good welcome, and she's already briefed a little about myself. So I'm a MBBS MD doctor who's done masters in alternative medicine, and I've come up with a blend. Basically, I come from a lineage of 12 generations of Hakims, Atibba, basically. So as we were growing up and we used Unani on ourselves, on the full family. So I had that inclination towards Unani from a childhood. Obviously, it came down through the generations. So when I grew up and my father got me into the medical school, and after I finished off, I obviously had this in mind. I had to somehow integrate every system together and bring out something that could benefit all. So actually, according to what I study and what I read and what I understand is that any particular system is not complete. Every system has its benefits, but it also has its drawbacks. So the positive and negative side is with every system. So it's not complete. And for a particular disease also, it's not complete when you go for a particular system. So it is an amalgamation where you should actually go for all the systems and combine all together. So that's where I come in. I've tried to bring a blend from allopathy, Unani, and functional medicine, and that's what I'm doing.
So just so that it's easy for everyone to understand, can you very briefly distinguish between allopathy, functional medicine, and Unani medicine? What's the difference?
Like in allopathy, we basically what we do is we go for the symptomatic treatment. If you have a particular disease, we go for the symptomatic treatment, and we also go for the cure where it's possible and where um, according to their science, according to allopathy, whatever researches are there, and according to that, we delve into the cure also for particular diseases, and especially in surgeries, we actually go for the cure. We go for the root cause where there is, and then we try to cure it. But for chronic diseases, somehow, unfortunate it is that we are unable to heal uh, through allopathy. So it is through functional medicine, which has recently, as you mentioned, recently come up in the past 10 years, I would say, or maybe it's actually come up in the past 5 years, and people are following it. It has the same concept. It actually goes for the root cause, mainly for chronic diseases. Acute, actually, it's more dealt with in allopathy, but for chronic diseases, yes, functional medicine goes for a root cause, and it tries to identify and try to eliminate the root cause, and then heal the person. As for Unani, which obviously is not some a century back, or it's not something that came 2 centuries back. It's there for past, I would say, 2000 years, or maybe earlier than that, because it was a time when Greek philosophers and Greek mythology, according to the time when Greek was at its peak, that time it started, and the father was Hippocrates, as we all know. He's also called the father of medicine. So it is from then that it actually started. So it's an ancient science, and it always believed it always believed in identifying the root cause and going for the cure. So I think functional medicine is actually on the lines of Unani or any traditional medicine that we are seeing. So it is somewhat a more recent approach to what Unani is already doing. But a little different, because functional medicine, they use herbs, but they also use different other modalities. So it is not only herbs, yes.
Can you give us like a little bit of a background on Unani medicine briefly? Like just tell us the philosophy of Unani.
Basically, Unani, as I said, it basically goes for the root cause. And Unani, we have three principles, uh, or basic concept that we have in Unani is about the four um, pillars, or the four humors that we learn. That is the first part, and it is the theory of the humors that was brought in by Hippocrates himself. And it is the same thing that Unani and the people and the Unanians and all the physicians across the world follow. And in this theory, there is basically one is Balgam. People, there's an equilibrium in all four of them. A person who is healthy has an equilibrium in all four of them. It is one is Balgam, one is Sodaviyat. Balgam is for anybody who's having respiratory issues, allergic issues, allergic issues. And then there is Sodaviyat, which is related to the skin or anything related to skin allergies. And then there is Safa, which is related to basically the gut, all the problems or anything arising from the gut. And then there is Dam, basically it's blood and blood related disorders, anything, blood pressures or anything related to. So that's the basic principle that Unani has. And then there is one thing that Unanians and Unani believes in is that every individual is different. So it's more like an individualized approach where everybody is different. So all the humors, the equilibrium, if it's disturbed, or if is there is an imbalance, then it's unique for every individual. So uh, the medicines or whatever therapy or whatever we have to plan, it's for that particular individual at a very individualized manner. That's what I would say. And then the third part is I would say the biggest the most important factor that Unani has is they believe in that every disease, the mother of all diseases, basically it comes from the gut. So the gut has a very important role in Unani. So people generally in the past 200 years or so, when allopathy started flourishing, they forgot this concept. But again, now functional medicine has brought in again the same thing, that a lot of diseases are actually arising from the gut. And all the recent researches also pinpoint that a lot is happening in the gut, and through the gut only, where a million or more than million microorganisms are obviously residing. And it's a symbiotic relationship where an individual's body and the microorganism, they are in a symbiotic relationship, and it's beneficial for both. And it's a biodiverse park, I would say. It has a million of different microorganisms. And the thing is, they're all unique. So there has to be an equilibrium, a balance in all of them. If any particular microorganism is more, then a particular set of diseases comes up and shows. So it's basically you have to have an equilibrium in your gut microbiome also. So this is a very interesting topic, and it's a different topic altogether, because gut I have not dealt with here, maybe later. And it may take hours to only talk about this, because it's also an immune powerhouse. A gut is also immune powerhouse. We'll talk later then. Yes, please.
Okay, fantastic. I mean, yeah, there's so many questions, but what I would like to do is, I know you have prepared some slides to help all the attendees kind of follow, follow your philosophy and follow your talk a bit better. So, would you like to share your slides right now?
Yeah, yeah, sure. Yeah, here's the slide, and then we are. This is a lecture that I generally give when I'm called to places, government institutions and other institutions. So there's a lecture slide that I'm prepared generally. So basically, with the help of Unani and modern science, allopathy, and a functional approach to natural healing for diabetes, and obviously, all these metabolic diseases and digestive disorders, anything coming from the gut, any disorders that are coming from the gut, then autoimmune disorders, a lot, like rheumatoid arthritis, body ache, fibromyalgia, skin disorders like eczema, psoriasis, hormonal imbalance, infertility, obesity, heart diseases. A lot of people also have generally clogged arteries, and high cholesterol, hypertension. So for all these, I've made this slide, and then we'll go through it, and then we'll be able to see. So basically, there's a Win insulin protocol that I have developed. Uh, a, a friend of mine also, basically, he's developed it, and we are together on this. So what I'm trying to say is, here conventional medicine, like I said, allopathic medicine is failing at chronic diseases, because they're good at acute diseases, but at chronic diseases they are completely failing, because they're not going for the root cause. They're going only for symptomatic treatment, and that's not what is actually required. So here we have a health system and we have a food system. So it is basically a major 90% of the chronic diseases are actually because happening because we are waiting to be sick. We are not identifying a particular disease before it actually happens. So we need to identify diseases before they actually start happening, or before they actually start manifesting in a bad way. So if we identify diseases at an early age, we are able to prevent a lot of diseases. And that's what we are talking about. We are talking about prevention also here. So this major topic would cover all the metabolic diseases and gut health. A major shift there is from healthcare to sick care. Basically, a person is healthy, but he's waiting to be actually sick. So this is what is actually happening here. We are waiting to be actually sick, because we have all the signs and symptoms, but we are unable to identify them, or maybe we are not approaching the right people, and we are waiting for the disease to actually start appearing in our blood test. So this is what is actually happening. We are waiting for the blood reports to actually tell us, yes, this problem has the blood glucose has happened, or the cholesterol has started appearing here, or maybe some other joint problems have started appearing, or other diseases have started appear. Diseases, no. Uh, the blood reports or the blood markers have deranged, and then after that only we go to the hospitals or the doctors to actually um, to help to get us help. So it's not that we have to go the other way around. We have to actually identify diseases before they actually the start appearing. And this is the modern approach. Basically, we are looking at an individual in this manner, because we have 40 specialties like cardiology, orthopedics, and then neurology, nephrology, and gastroenterology. So we have so many specialties, and we are not looking at an individual as a whole. This is a major drawback that we are seeing. We are looking at individual problems, individual organs, and we are going to that individual specialist for that, and trying to get cure for the particular disease. But this is actually a wrong way, or maybe um, an obsolete way to actually approach or look at diseases. So we need to identify diseases as an individual. We have to look at the whole picture and not at individual signs and symptoms. So, so we have to move forward in this. And there's one conception that people have, that if we have something in our DNA, like if we have diabetes, or if we have heart disease in our family, it is 100% that we'll have to carry it, or maybe in us and in our progeny, that's our future generations that have to come. So it's not correct. Basically, if the DNA can make an RNA, so there's reverse transcriptase, and it can also go back. So it's not necessary that something that you're carrying from your parents, it has to be carried down and down for the generations. It's in your hands, and you can actually help reverse this phase. So it's not anything that is genetically driven. And then this is a basically insulin resistance model. This mainly we are targeting all these diseases. I'll be catering to all the diseases, the ones which we talked earlier. But here I am dealing with mainly with all the metabolic diseases. This slide is mainly for metabolic diseases, and how with functional medicine and allopathy and how Unani, we are combining everything and getting better results. So here we have basically, because of high insulin levels in our body, because of the recent change in the past 50 years in our lifestyle, in our food habits, in our sedentary lifestyle that people are having, less movement, all these problems are creeping up, and it's all because of one major issue, that is high insulin in the body, high insulin secretion. And because of that, there's hypertension, there's diabetes, there are heart diseases, and PCOD. Basically, this is hormonal imbalance in females, girls, infertility in males and females, and then obesity, obviously that's prevalent everywhere. And then Alzheimer's in elderly, we are seeing a lot of degenerative aging in Alzheimer's and Parkinson's. So all these problems can be sorted, or can be prevented, or better, if people are actually suffering from any of these, we can actually help them limit the complications. And even a lot of people, actually a lot of patients of mine, are actually free of medication which they were taking for the past, I would say 5 years or 6 years or 10 years, and they are actually free of medicine. So in all these conditions, we can actually help them, maybe reverse the condition, or if not reverse, at least bring them to a healthy level where they are off medicines, or if they are on medicines, they are on very low doses which are actually not very harmful of allopathic medicines. So uh, and then I'm moving forward again. So this is what is actually, I won't take too much on this, because this is very monotonous. It won't people will fall asleep. So I'll go through this very fast. So this is why actually what happens when we have a lot of sugars, because of the fast foods or the food that we are having, even the normal wheat and rice that we are having. I'm not talking about the fast food or the burgers or the Chinese food or anything. I'm talking about the normal wheat and or the normal fruits and everything that we are having. They are having a lot of genetically modified uh, food stuff that we have in the market. So what happens when we have genetically modified food stuff? It is actually made to be there on the shelf for a longer period, so that it doesn't decay. It stays there in the shelf for a longer life. It has a longer shelf life. It can be exported. So obviously, if we have to have that, we have to make some changes in the genes of that particular food, so that it stays there in the market for a longer period. So the genetically modified have less of fiber, which increases the glucose in the body, in that particular like wheat or rice, and then that becomes harmful. So whatever we are generally having are genetically modified. We should have whatever there is, all the grains that we have, they should be not genetically modified, and um, more of ancient varieties that people used to have 50 to 100 years back, like khapli wheat, or maybe red rice, the varieties which are not basmati, which were there 50 to 100 years back. So those general varieties we should have. And then we should avoid fast foods, and a lot of exercise, or people should move around a lot, so that we don't have a lot of insulin in the body. Because if we have a lot of insulin, then obviously all these problems are going to creep up, the ones I discussed here. And this is the journey that is there, because a person is well. So we are here at the start of the journey. And then there are risk factors, that is primordial prevention, where we see the risk factors that are there in a particular person. A person is actually gaining weight, or person, I'll show you the other signs and symptoms also, that we can identify easily. And at this stage, if we go for prevention, it is called primordial prevention, and we can help them actually prevent disease. So this is at the very beginning, and then the disease starts after that. This is the onset of disease as we go further down the lane. And then we can still prevent the disease via, it's called primary prevention. And then for people who are already on this journey, and they've got a particular disease, and they are on this path, then we have secondary prevention, and still we can prevent the disease. And we have a lot of people who have prevented the complications and reversed the disease, and they come back to wellness, complete wellness. So in all the issues that we discussed before. So, and we can even prevent complications. If not complication, we can at least reverse. If not complete reversal, we can at least have people on basic minimal doses, and be completely healthy without any complications. So here it is, basically, there are some blood markers that we can that can help us identify issues much earlier. Like diabetes, generally people think it is 7 HbA1c that we should look for if we are diabetic. It's not 7; it's basically 6.5 and above. Anybody above 6.5 is actually diabetic. And if you have to identify a disease earlier, it is basically pre-diabetes that we can identify before. From if you go for all these three blood markers, which is fasting blood, HbA1c, uh, and a postprandial after food blood sugars, then it is, if you have to identify it before, any person who's in the range of 5.7 to 6.4, he's in the pre-diabetic range. So he's on the border range, and he can prevent the disease by obviously changing uh, his lifestyle and exercises. And then there's pre-diabetes, where we have anything below 5.7, which should be completely normal. But they have other markers which are deranged, which are basically triglycerides and HDL and VLDL. If they have the triglyceride and HDL ratio more than 1.5, then they are going in that phase of pre-diabetes. So we can identify people who are below HbA1c 5.5, but they have other deranged markers like triglycerides and HDL, and then we can identify them before even they are at the border. And then there's a person who's completely normal, who has a normal lipids and normal HbA1cs and normal low. So this is the green that we are talking about. That's a person who's completely normal. So people who have in their family, and who are themselves suffering from any particular disease, or probably diabetes that I'm talking about here. So they know where they can help themselves by identifying these markers for themselves and for their family. And then there's one thing which is called lipotoxicity. Basically, what the major reason why diabetes and all these diseases, the metabolic diseases happen, is because of lipotoxicity that happens in the liver. It starts in the liver. Basically, when we have all these kinds of foods and we have less movement and less exercise, what happens? A lot of sugar is already going there and it's not utilized. When it's not utilized, it goes to the liver and it causes toxicity there. So liver is the basically detox organ of the body. It's the major detox organ of the body, and it takes the major brunt in our body. So all the toxicity that all the sugars, the high sugar and high fat that is absorbed from the intestines and the gut, it goes to the liver actually, and then from there it is actually metabolized. But when we are having too much of GMOs and a lot of fast foods or whatever, even if we are having a normal diet but we are having GMOs, genetically modified grains, which have higher shelf life and higher glycemic index, GI index, more glucose, but they release more glucose. So if you have those kind of grains also, so the liver has a lot of uh, toxic glucose levels, and it causes lipotoxicity. It causes a lot of fat absorption within every individual cell of the liver, and it causes glucotoxicity, and then people become pre-diabetic and obviously then diabetic, and then the other problems come up, that is hypertension and heart diseases. And it doesn't happen in in a short span. It happens over a period of time, or maybe a decade, or maybe 5 years or 10 years. So we have if we have to take a decision, we have to take it now. We have to stop, and we have to try to reverse the conditions, but we have to take decisions now, and that's how we can prevent diseases. And these are the red flag warnings, or the signs and symptoms that we can identify in a particular person before any actually disease actually creeps up. So these skin tags that we can see, and a lot of pimples that we can see, black patches or pigmentations on skin, on the neck, on the cheek, a lot of hair loss, and a lot of boils, or in the armpits, around the neck, around the back. Uh, so a lot of people are actually having these. Any of these symptoms, they actually help you identify that it could be a problem that is pointing towards metabolic issues, which have just started. And uh, dark pigmentation, not only around the face but around the neck and armpits, around the groin area also. So this is how a particular person was, or were, how mankind actually evolved over a period of um, centuries and millenniums. Uh, we were like this, and now obviously everybody was fit before, but with this new age of approximately, I would say, 50 or 70 years, in this new age, when the um, all these genetically modified grains came up, and all all the fast foods and sedentary lifestyle came in, and a lot of luxury came in, then a person, obviously people started gaining weight. And with gaining weight, with the toxicities in the liver, with a lot of fat accumulation in the liver only, it doesn't happen only in the liver. First it happens in the liver, and then it goes to the surrounding organs, and then all the organs are filled with fat, and then it's called visceral obesity. All the visceral organs, they are filled with fat, and then comes the abdominal obesity, and then a person starts becoming fat, gaining weight. So this is how the procedure is. So we need to identify it and correct it mm, at this level. So as I told you, you can see here all the organs, they are building up fat, and fat is accumulating in all these organs. And once fat accumulates in all these organs, they become more dysfunctional. So I think we'll we'll just wrap it up because this will become too scientific and people won't enjoy it much. But the basic is what I have told you. We should identify diseases at a particular um, early stage, and if you are able to identify disease at an early age, at an early stage, we are able to actually prevent diseases and their complications. So the basic reason is high insulin. We should try to avoid high insulin and prevent diseases.
Yeah, no, I think this is fantastic. So to summarize, I guess what you're saying is that a lot of our diseases come from our diet and I suppose our lifestyle, but mainly our
Definitely.
diet. And a lot of that has to do with an inability to manage our blood glucose, which is heavily related to insulin.
Yes, heavily related to insulin and obviously our diet, which is a lot of um, glucose and fats that is going in, and a sedentary lifestyle that is causing us. And then because of this, my slide which I'm just showing, it's showing the arteries of the entire body. So they start clogging up. There's plaque development in all these arteries, and then we don't realize it in the initial time, and then with years, with as the time passes, within maybe 5 years, 10 years, as the time passes, the all these arteries become clogged slowly, slowly, layer on layer. They have fat and atherosclerosis, and because of that, every organ has less blood supply. Not only the heart, the other organs also, they all have less blood supply, and because of that, the functioning becomes poorer and poorer, and they become dysfunctional. And that's when we start developing complications. So we should prevent. It's not only about heart diseases, because it's related to every disease in the body. And then this is the basic pathophysiology that we've discussed right now. And then obviously how we can prevent all these diseases, and how we can actually help people, that's we will discuss just ahead.
Can I stop you for a question?
Yeah.
A question from a participant, and also this is quite frankly something that I struggle with, given that so many of our foods are being villainized. I mean, you said even if you're not having fast food or ultra processed food, even our regular diet of wheat or rice heavily sprayed with pesticide and things that increase the longevity of the foods. In this case, what should we eat if everything is bad for you?
Definitely. No, actually, the thing is, it's not. Well, it's not that it's everybody is at fault. It's basically people actually look for better alternatives for everybody. So what they it's the demand that everything needs to be exported, and people used to they want everything from all parts of the globe. So
Mhm.
for that, obviously, you have to have pesticides, you have to have preservatives, and you have to have a lot of chemicals in it that makes the food toxic. So all the packaged items that we have generally in the market, they all have preservatives, they all have pesticides, and they all have chemicals to actually prevent them from decay. So that's one thing. So we should be cautious about having packaged items, and we should have less and less of packaged items. But anyway, for all those who are actually abroad and they cannot do anything about that, there's one thing. Other than that, if you're not having packaged items, we are having grains. If you're having grains also, the ones that are genetically modified are the ones which look beautiful. If you talk about basmati rice, the longer the grain, the whiter the grain. It is obviously it the all the pulao and the biryani there. It's made in basmati. It looks good. It has a longer shelf life, and it's tasty also. But then obviously it has its drawbacks. So the thing is, we cannot have everything on our platter. We have to have either a, a tasty food, or a biryani, or we can have red rice, or maybe ancient varieties of rice which also have the covering. They are not polished rice, and they are ancient varieties which are not genetically modified, and are not as tasty as the ones which are available nowadays. So generally, we in my family, everybody has those ancient rice. They are generally white, red in color, and they are coarser, and they are thicker. They are fat, small rice. And if you talk about wheat also, the kapli wheat is different, and the roti, that the chapati that we make from this wheat is actually thick, and it's not as tasty as the ones we get in the market.
Now, what
So
do you recommend? Give us like some other like broad guidelines. So from what I understand, you're saying don't eat things that are ultra processed or refined, like basmati rice, long grain basmati rice. Eat local food so that you can make sure that it's not come from the other
we
side
can
of.
have low GI, we can have low GI grains like millets. We can have quinoa. We can have khapli wheat, a variety of wheat which is an Asian variety, and then we can have the red rice or the varieties of rice which were earlier. They are generally thick and long, small, thick, and obviously not processed. So we can have those varieties.
There's one more.
As for grains, one sec. As for grains, we can have those. And other than the grains, the basic criteria that we should have a lot of vegetables in every meal. Before we start actually a meal, we should have a lot of vegetables, and then we should have a bulk of protein, and then the carbs should come at the last. So this should be our sequencing in a particular meal. And as for the time, we should have early dinners. That's one thing that I would suggest everybody having early dinners, maybe after around 6 or 7, or maybe earlier. The early dinners, and then breakfast. If not if you can delay a little bit of breakfast, maybe 9 or 10 in the morning. People going early for job, they obviously have to have early. I can help them, but uh, a little bit of uh, intermittent fasting would help. Like if we have overnight fasting, it's not intermittent, it's overnight fasting. We have early dinners and a little late breakfast, not very late, but 9 o'clock or 10 o'clock is fine. 12 hours or 13 or 14 hours is good enough for overnight fasting. So this is healthy. Early dinners, and then having this sequencing in a particular meal, and then these kind of grains which are not processed. This is very healthy. This is according to the nutritional plan that we have. And then we can come to the if a person is actually suffering from a disease, then we can actually go for the Unani medicines to help them. Obviously, so nutritional therapy is one thing, and then there's diet therapy, and then there is this drug therapy that we have for any individual. So we have to have a combination of everything to actually help people.
I think this is a very nice segue for us to get into particular diseases that you talked about. Is it okay for me to ask you questions around that now, or
Sure. Yes, yes.
we go and get into it? All right. So perhaps you can tell us, just so that we make it very practical for everyone attending the webinar today. What is your approach to treating metabolic diseases like diabetes, hypertension, yeah, and diseases like that? What is your, maybe you can tell us a little bit about your personal approach, since you combine allopathy and Unani.
Now, as I said earlier, uh, there are three modalities that we use. One is obviously the amalgamation of all allopathy and Unani together, and functional medicine. But the thing is, the first is basically nutritional therapy, where we have this diet therapy. According to Unani, also the first ilaj bin Ghiza. Basically, it is ilaj bin Ghiza is uh, food is thy medicine. So we should start with first the nutritional therapy, where we should avoid whatever like we just discussed, how we have to go about the meal sequence and the time that we should have the early dinners. So this is for nutrition, for all the metabolic diseases. We should have low glycemic index foods. We should have a lot of vegetables, and we should avoid sugars and processed foods. So this is one thing. And then the second thing is using medicines. So we actually use a concoction of herbs to actually help people activate the enzymes in their pancreas and the liver. So once you are able to activate your own body system and your own organs to start producing insulin and the other hormones, other uh, enzymes, the pancreatic enzymes and the digestive juices, then we are able to actually um, help people help people better and with sustainable results, and even in a very short span of time. People only going through diet therapy, or maybe only with allopathy with diet therapy, that's one way. But I've seen with the amalgamation of all this, we are able to deliver better results in a quick time frame, and long lasting sustainable results. So obviously with the help of herbs.
Right. So does that mean that your patients would then take this Unani medication for a period of time, and then after that they can control their condition only through diet?
Yeah, that's what I'm saying. So only the diet is there for lifelong, but for the medicines, they are only there for some time till a person is actually able, has reversed the condition. If the person has actually reversed the condition, he is completely off any medication. And if what we do is we actually taper the allopathic doses also once we start our Unani medication. So nutritional therapy is there throughout, and then as we start Unani medicines, and as we see the blood reports every month, and we see the blood reports becoming better and better, we start tapering all the allopathic doses slowly and slowly, and then a person is completely off allopathic medicines, and then he's on this Unani medication for some time, and then slowly, he's off all the medicines. But this is only true for people who are actually very strict with their diet, and who actually follow the protocol that we've given them, and they're following it very religiously. Then they are able to actually be completely off medicine. And we have a lot of patients who are actually off medication completely. But then there are people who are not able to do this, and they are enjoying their everyday food also, and they are partying also, and they are doing all what they do. Then obviously we are not I cannot commit on anything. Then obviously we cannot obviously stop all the allopathic medicines also. In that case we have to make a balance, and equilibrium has to be set, where there's a maybe a small dose of allopathic medicines and maybe a Unani medicine with whatever dietary protocol a person can follow. So that's how it goes. So it this is for all the heart diseases. We have a lot of patients who have actually who are suffering from angina, who are actually suffering from clogged heart arteries, and then they were able to actually be free of angina. That means the collaterals started working properly, and the function of the heart also started became better. And then the clog, the atherosclerosis, or the layers of fat deposition that was there in the arteries, that has minimized, and then obviously the blood circulation increases.
That's that is so that gives me so much hope, and I'm sure it gives a lot of people watching this webinar a lot of hope, because heart disease is quite prevalent, and it's become very routine for doctors to put patients on statins. And we know that there's a lot of complications that come with long-term use of statins. I know more and more people in their 30s are being put on statins, and it's quite scary. So what you're saying is
And it's for lifetime. It's for
yeah.
lifetime. People on statins, people on anti diabetic drugs, and people on heart diseases, on lipid disease, anti-lipid drugs, and people on blood thinners. They are there for the lifetime. They Once they start, it's never ending, and it keeps on increasing. Once they are on diabetic medication or whatever medication, it's one drug in the initial phases, and then slowly it's two drugs and the three drugs. With every decade or every 5 years, one more drug adds up, and then by the time they are 60, they are having a full handful of drugs or
Okay.
medicine.
So
So
I want
that's what's actually happening.
thank you for that. I want to move into something. We're getting this question a lot. A lot of people are asking about fibromyalgia. What is fibromyalgia? Is it a metabolic disease? Tell us a little bit, just briefly, about fibromyalgia, because we have so many questions.
Yeah, I think people suffering from fibromyalgia, they have body ache, they have pain in the body, they have pain in the joints, they have pain all over the body in their muscles. So, and there's no reason for that. But in allopathy, it's basically there's no reason, and we are unable to identify it. But according to us, a lot of people are actually having joint pains also. It's not only fibromyalgia, it's joint pains also. They have knee problems, they have pain in the joint, they have pain in the back, they have pain in the shoulders. So all this comes under musculoskeletal system, and what we take it as one particular system. And uh, as I said, my approach is always like in a three-dimensional way. One is nutritional therapy that we discussed right now. We have to follow that. Okay, a
Same
lot of people.
for all, or would it be different for somebody who has musculoskeletal issues?
No, no, no. It's not different for musculoskeletal. For gut issues, yeah, it's completely different. And in gut issues also, for various other problems like hyperacidity, it's a different issue. It's a different diet therapy. For people who have ulcers, different diet therapy. But for musculoskeletal and all the metabolic diseases, we follow the same low insulin or low glycemic protocol, where we have low sugars. We have to avoid sugars in any which case. So the thing is, we have this particular diet therapy that a person has to follow, and then a, a regular exercise. That is what is actually required. People should have a regular exercise. Uh, People still are suffering from fibromyalgia, but still, if they follow this particular low insulin diet and they do regular exercises, a lot of people are actually off pain, and they are symptomatically better. But people who have not still after both these things, they have still not recovered completely. They can actually then we can help them with actually drugs. That's what Unani medicines. And with those Unani medicines, we actually um, we target the nerves and the synovial joints and the discs. Like, it's not only a fibromyalgia, I'm talking about the joint pains also. Like, if there is synovial membrane thickening and inflammation, so the drugs that we give, the Unani medication that we give, so it actually the medicines work on the inflamed membranes, and they bring down the inflammation. They help secrete the synovial fluid that is there in between the joints, which dries up as there is in inflammation, or there's a lot of sometimes there's a lot of fluid which actually which causes the joint to swell up. So with our medication, the inflammation goes down, and there's more of secretion of the normal synovial fluid. So it helps. And the people with the joint problems, and the people who have a backache, disc prolapse, bulging disc issues, sciatica, or cervical or lumbar spondylitis, they can how we work is basically it's again it's two ways. One is, this skeletal system is made up of bones. So basically we have to strengthen the bones, the joints, all the vertebrae and all the bones. So a person should have good vitamin D levels, because it also imbues the immune, and it also helps people with joint problems. So we should have a high dose of vitamin D levels with vitamin K, because taking alone only vitamin D doesn't help. We should have vitamin D along with vitamin K. And I think calcium is enough in the diet if a person is having leafy greens and the diet that I suggested. So calcium is enough, but still, if people want to supplement it, they can supplement it. So basically, vitamin D with vitamin K2 and calcium with magnesium. These are necessary. Any person who's having all these issues, they should have um, these micronutrients, or we call elements. They should have these, and then a lot of exercise and the dietary protocol that we are suggesting.
So
And still, if you are having problems, then we can obviously give Unani medication.
what form of magnesium do you recommend? Because I know that there are so many forms and it's so
I
confusing now.
think magnesium glycinate is the best form that is currently available, and we should have it. And the particular dose is 500 mg or 400 mg. Some people are some companies are giving at 250 mg. That's fine. 250 to 500 mg. Anything of magnesium glycinate on a daily basis can be taken. it's not only for fibromyalgia or people suffering from other joint problems. People who have tetany, like spasms in the muscles. A lot of people have spasms in their legs, in their muscles. They can also have uh, all of these combined, vitamin D with vitamin K2, a little bit of calcium and magnesium. This will help all people who are having joint problems and pain issues.
Tell us about the Unani medications that you use to treat musculoskeletal issues. Just a general. I know it's not going to apply to any particular person. Everyone asks what they got.
It's basically herbs that we are using. We use Soranjan, that's a herb that we are using. Then we use ashwagandha, people call Withernaria somnifera. That's the English or the Latin name. That's ashwagandha. If I think people are quite they must have heard ashwagandha. So Suranjan, ashwagandha, ojai, and then they are it's a basically concoction of medicines that we use to help people with inflammation, to decrease inflammation in the joints. And it doesn't actually decrease only inflammation. It also is a natural analgesic. So it helps people with pain and with inflammation. So it's a natural anti-inflammatory and analgesic. So it prevents a lot of people who are having allopathic or modern medicines or maybe painkillers, because they actually harm the kidneys and the liver. So a lot of damage is being done because of these painkillers. So people can prevent themselves by having natural alternatives, natural anti-inflammatories like curcumin also. Curcumin, ashwagandha, suranjan, these with these can help. These are natural anti-inflammatories.
This takes us to like a very interesting topic. Just I know that the gut is a major, it's a very big topic, but do you think you can give us a little bit about your approach to treating gut dysbiosis, which, as you said, is the mother of all disease? So, how do we identify that? How do you treat it? Give us some background on what do you do?
Basically, this is a very big topic in itself. Gut is actually, like I said earlier, we can go on for hours on this, because um, in Unani, it's called, what it is, Ummul Amraz, basically the mother of all diseases. It comes from the gut. So in Unani, the basic principle of Unani is from the gut only. Every disease is every disease comes from the gut. So we actually have to help heal the gut and prevent it from all the diseases. So how we can do is actually, it is basically the gut is the first point of contact, actually, for a body with a foreign organism or any foreign particle, because what we ingest is anything foreign to our body. eh? It goes first into your gut, and when it goes into the gut, all the defense that there is in the body, that is called the lymphatics or the limbic system, it's actually surrounding the gut, surrounding the intestines and the stomach. So every thing that is, every nutrition, every food that we have goes to the gut and is absorbed from the gut. So all the nutrition, we obviously we the body absorbs all the nutrition from there, but it also has a lot of toxins that are coming there. So that's why the first line of defense is in the gut, which prevents and which has all the antibodies in the lymphatic system, which is surrounding the gut, which actually helps and prevents us from any foreign particle. And the body actually is the first line of defense. Whatever any foreign particle comes, it makes antibodies against it, so that it doesn't harm the body. So the first line of defense is there. And then another thing is, it is filled with microorganisms. Earlier, according to Unani, which was 2000 or uh, years back, research that was there. But the latest research, according to functional medicine, also all the latest research points out that every disease creeps up from the gut. And it's not only the gut we are talking about, it's a major, it's a full it's a completely new world inside our body, because in our gut is a plethora of organisms, millions of organisms. It's a biodiversity that is totally unique. Every organism, microorganism that is in the gut, it's completely unique. So if a person has an imbalance in the gut, as you said, dysbiosis, basically a dysbiosis is the imbalance of the microorganisms in the gut. If we have imbalance in the gut, a particular disease can creep up. It's not only related to the gut, it could be anywhere in the body. It could create havoc anywhere in the body. It could cause hormonal imbalance, it could cause pimples and uh, skin pigmentation, or any particular ailment. So the gut is very important. As for dysbiosis, yeah, definitely. Uh, we use natural ingredients. First, we have to have an elimination diet. Particularly for dysbiosis, we have to have an elimination diet where we avoid all the uh, we have at least 4 5 items that we have to avoid in our elimination diet. First is wheat. Anything that has gluten we have to avoid. eh. Then we can have rice because it's gluten free. And then we have to avoid anything that is gluten. Then we have to avoid all dairy, we have to avoid all sugars. We have to avoid all processed items, we have to avoid all packaged items. And probably if we can also avoid vegetables which with pesticides. So better to take organic and have to have less or least of chemicals inside. So avoid Chinese food or any sauces or any chemicals or any prepared ingredients that we get, masalas that we get to actually add to our dishes. So anything that is chemical, we should avoid it, and we should have organic vegetables. So this is an elimination that we have to follow.
One
eh.
question,
And
when you say, sorry, doctor, to interrupt you, but I have this question here as well, and I personally have the question as well. When you say sugar, do you include in that fruit, raw honey, and dates as well?
raw honey, if you are able to procure genuinely raw honey, I wouldn't say no to it. But definitely a person can have pure raw honey if he's able to procure it, because in the market a lot of adulterated products are also there. Anyway, as for sugars, yeah, I would say fruits are genuinely they are the best nutrition that we can have. A lot of minerals and vitamins we can get from fruits, so we should have fruits. Not for diabetics and other people who are having diseases. We can have fruits, but in a limited quantity. But for other people, generally people can have a lot of fruits. But everything in moderation is good. So a lot of fruits in moderation, but and then with the elimination diet. And then there are antifungal and antibacterial agents, natural antibacterial and antifungal agents that we use for the gut, for to correct dysbiosis. Because if you have to correct dysbiosis, elimination diet is only to prevent allergies and to prevent inflammation in the body. But to actually heal the gut, we have to actually eliminate the dysbiosis and the proliferation of a particular group of microorganisms. We have to eradicate, or maybe bring an equilibrium in that in the gut. So for that we have to use natural antifungal and antibacterial agents, which help us maybe in 1 or 2 months, which help us in actually bringing that equilibrium. Once the equilibrium is brought in, we can stop the elimination diet, and we can slowly start adding one item at a go. And then we can see what particular ingredient or what particular food item we were allergic to, and we can stop that and start having the rest. So that's how elimination diet works, and that's how we correct dysbiosis.
Thank you. I mean, that's very helpful. I know it's a huge topic, but I
We
want to
don't,
slide
we
it.
don't use Yeah, we don't use allopathic antifungal agents. We use natural antifungal agents, and we are able to actually help people
What's
completely.
of a natural antifungal?
There, like neem, if you've heard of neem and curcumin, and there are a lot of. It's a concoction. We have 8 to 10 items that we use, but generally neem and curcumin everybody can have. It's anti-inflammatory, like for joints also, and it's good for the gut also. So a ball of neem and a ball of curcumin on an empty stomach daily can help people stay healthy for a longer period. So they can have it on a daily basis also.
Fantastic. Okay,
Prevent it from dysbiosis also.
so I want to move on to the slide that you have up here. It's quite interesting. You have something called horror autotoxicus. Can you tell us about all these diseases? I think that they are, I mean, together they're quite common. What is common about these diseases?
I think our topic that we are discussing right now, the gut and the immune system that is surrounding our gut, the first line of defense, is basically when we create havoc in that particular line of defense, the limbic system or the lymphatics or the immune system of our body, then all these problems come up. Basically, if you're having a lot of chemicals, if you're having a lot of um, high glycemic foods, and we are having a lot of chemicals and Chinese and um, g- uh, junk food, then we obviously create problems in our gut. And with the gut, the surrounding, actually, the lymphatics and the limbic system, they are very closely connected, and there is a lot of exchange happening uh, in there. A lot of nutrition is actually absorbed, but with along with that, a lot of toxins are also absorbed, and because of those toxins, the lymphatics and the our immune system takes a toll, and it goes for a toss. And with that, all these autoimmune problems, skin problems, celiac disease like the gut diseases, eczema, psoriasis, the skin issues, the allergies in the skin, rheumatoid arthritis, the pain in the joints. It's a basically autoimmune disease, asthma, Hashimoto's, thyroiditis, and multiple sclerosis. Many Crohn's disease. Crohn's disease is inflammatory bowel disease, basically in the gut, when we have gut ulcers throughout in the gut. So all these kind of issues, they come up when our actually immune system is damaged. So if we have this elimination diet first of all, and then we try to help our immune system recover with obviously medicines, and obviously with the help of immune booster um, nutrients also, like vitamin D or vitamins, vitamin C, vitamin D, magnesium, along with the help of nutrients and food, diet therapy and elimination diet, and boosters from herbal concoctions, we can help the immune system recover. Once we are able to help the immune system recover, all the auto antibodies that have formed against our own body, basically auto this is all these diseases, they are autoimmune diseases. Basically, our own body, our own defense system has made auto antibodies against our own particular body parts, and they are damaging our own body system. So once we are able to heal the immune system, all these problems, they slowly recover. But generally, it's not same for everyone. Some people get very good results, some get mediocre results, and some people have a lot of relapses often. So I have people who have completely cured of the disease, and I have people from the other spectrum who have benefited a lot, but and then again and again they have relapses, but they generally have less relapses. And again, here it's not only diet therapy and the drug therapy that we are talking about. There is one more therapy that we use, and that is regimental therapy. That is the use of a lot of uh, purgation, that a lot of medicines that we use for purgation. It's basically we purge the entire gut. So it is with the use of herbs that and what people see is they have 20 to 30, um, I would say, loose motions, or the motility of the gut is increased. um, Once the motility of the gut is increased with the help of medication, we actually help the gut, the body, to actually purge the body of the toxins that are present in the gut and the immune system and the lymphatics. So this is one more therapy that we use for autoimmune diseases and for gut diseases.
What kind of purgatives do you use?
It's basically tripla that we use and some little bit of a very small dose of poisons, the herbal poisons, or I would say therapeutic poisons that we use.
Got it.
And tripla is a major one that we use to for a milder purgative. We use this. Or sikmunia is one particular herbal poison that we use in very small quantities that actually helps in purgation.
Mm. I have a lot of questions on eczema and psoriasis. Can you tell us particularly about these conditions?
Eczema and psoriasis, basically they are skin problems, they are skin allergies, and they are basically autoimmune diseases where our own body is actually fighting against our own organs. So it's the same which we talked about now, that we have to first have an elimination diet for a particular 3 months. That's a diet therapy that we have. Then we have to have the help of nutritional minerals and vitamins to boost the immunity with vitamin D and vitamin C, magnesium to boost immunity. And then we have to have the help of herbal medicines to actually elevate our immune system. And then we have to have this purgation with the use of herbal or therapeutic poisons and therapeutic fasting. So all this combined, I think five, I would say we have these 5 pillars to help people with autoimmune conditions and gut conditions.
Fantastic. I want to move on to something. I think autoimmune is also autoimmune conditions, gut dysbiosis. A lot of these things are very closely tied into stress and the mind. So can you tell us the role of
It's called the gut brain axis, actually. The gut is actually linked with the brain. It is the vagus nerve which goes from the brain to the gut, and it's new researchers have come up. It was earlier in Unani, it was always called that it's all there in the mind and it happens in the gut. And whenever you have a particular meeting or whenever a person is anxious, he tends to go to the loo often. So this is obviously it's a relation that is there in from the gut to the brain. So it's called GBA, gut brain axis, and definitely it's linked. People who have gut issues like IBS, people have inflammatory bowel syndrome. They generally, whenever they are anxious and whenever they are depressed, or whenever they have this particular meeting or any excitement that is built up due to any reason, they have this increased motility, and with this increased motility they have this frequency to visit the washroom or the restroom.
tell us
So this is brain access, and people who have depression and who are having um, these mood disorders, they generally tend to have gut issues. So if you are able to help them in their gut, if you are able to heal the gut through the procedures that we mentioned just before this, if you are able to heal them through the elimination diet, through boosting the immune system, through purgation, and through the help of medicines to actually upregulate our immune system, and then to actually help the neuro transmitters that are secreted in the gut. If you are able to activate the neurotransmitters that are present and secreted from our gut, if you are able to activate them, we are able to help people who have um, mood disorders or psychiatric issues.
could
So
it
yeah, definitely this
could
is
it
linked.
could it work the other way as well? I know that there are some people these days that are studying the effects of meditation and on our bodies, and and how sometimes meditation and other spiritual practices or mental exercises can affect our gut health. What's your opinion on this?
I think that's completely right. That's one. I should say health is not under the domain of one thing. It is basically a mix of, I think, ten or more things that we can do. One is obviously, the first thing is keeping mentally calm, yeah? A healthy lifestyle, maybe doing meditation, and a lot of breath work, which actually helps increase the lung capacity, but at the same time also increases the blood flow to the brain. So a lot of breathing exercises can be done. So they cover both parts. They cover the lungs to increase the um, oxygenation of the blood to every part of the body, and and the blood going to the brain. So one is meditation, one is breath work. The third would be having a healthy diet, the diet that we discussed, free from sugars and free from processed foods, and having a lot of natural ingredients, and low glycemic grains, and fruits, and natural, and having a heavy and having um, a very particular set of timetable set for the day, like having early dinner and a little bit of late breakfast, and maybe skipping sometimes lunch. So a little bit of intermittent fasting once in a week, or maybe twice or thrice in a month, if a particular individual can do that. So and then we have intermittent fasting, and then we have regular exercise. Exercise is also not uh, 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 I think 20 to 30 minutes of exercise is very good. The recent research in US shows that people who are who are doing too much of endurance training or marathon running, or too much of strenuous exercises, they actually they damage a lot of their joints, and the lot of membranes, they take a toll, and obviously a lot of wear and tear occurs in these joints. So uh, for a lifetime, I'm saying, if a person does 20 to half an hour of exercise, which could have 10 minutes of high intensity interval training.
Mm.
Obviously, with age, you have to decrease that part, but 5 to 10 minutes of high intensity interval training, and then you have stretches for 5 to 10 minutes, and then of 10 minutes of strength training, where you do against weights or machines, that will help your muscles to build, because muscles are the main organs that actually take a lot of glucose. So if you're having any food which you are also enjoying and relishing your food also, and if you have a lot of muscle mass, then you can actually help yourself actually maintain your glycemic levels, even if you are having a little bit of sugars. So building a good muscle mass also helps. So a combination of exercises and intermittent fasting, and having a healthy lifestyle and meditation, and like what we all discussed, is generally healthy. So it's all a combination of everything combined, and good relationships.
Good relationships. I think there's a lot of research coming
Important.
about that, about the effects of loneliness on the brain, and how it, how it messes up your system, contributes to inflammation in the body. So I think that's quite key. Thank you for that. And I think we're becoming, I don't know. I mean, in some ways we're more connected with phones, but in many ways we're also more lonely. Um, so it's a very interesting times that we're living in.
Definitely, definitely.
I want to go into a question. I have a question here about cupping. Can you tell us about what is the appropriate use for cupping or bloodletting, and when do you recommend it?
Yeah, according to modern science, I link it with modern science actually. Um, this was something which came from 2000 years back, and even before that, because in Egyptian times also bloodletting was used to be done, venesection and these things. So it actually helps your bone marrow cells, or the totipotent cells, or the stem cells to activate actually. So this is very good for your body. If we have regular on a regular basis, if we do blood donation, it's not only bloodletting, it's you can even donate blood. If we do doing if you're giving doing blood donations, and cupping, or anything that is um, uh, giving out of blood from a body, it actually activates your bone marrow cells to produce more blood. So then what happens is your stem cells get activated, and your stem cells get activated. Then what happens? your body is energized, your body is making new cells every now and then what happens is um, you can remain uh, healthy for a longer period of time. What when we talk about longevity, I think longevity, a lot of recent researches miss out on this particular part, which is bloodletting. For these for longevity, and a lot of doctors who are talking about longevity, they talk on all the topics that we discussed in my last question, but they miss out on bloodletting. Thanks, you brought this question up. So basically, when we activate our blood cells, when we activate our bone marrow, we are producing new blood cells, new cells in our body. And it's not only cells of the blood only, it's basically the entire body is getting rejuvenized. And if a person who's got new stem cells and who's activated his marrow every now and then will have um will be able to fight diseases much better than a person who has a slow down or a sluggish bone marrow.
Right.
Yeah.
I think,
And one more point that I'm missing is uh, when we make too many injuries at a particular small, I'm sorry, is it working?
yeah, yeah, it's working. Yeah.
Ah, at a particular small space in our body, if you are making too many injuries at a particular uh, at a particular small area, what we are trying to do is we are actually trying to deceive the body. We are trying to play with the body, and the body, our body is actually thinking that there is, it thinks that there is an injury happened, and it tries to produce more stem cells, and it tries to activate the bone marrow to produce more cells and more and there's inflammation, and there are more cells to actually heal the body, the particular part which is injured. But in this way we are actually activating our full body. So this is basically, I would say, a magic trick that cupping is doing through, but it's not actually injury, that we are not injured actually. It's a basically, I would say, it's a more planned injury that we are doing, and at a small segment or a small part of the body, we are making a lot of injuries, maybe small needles, about approximately small 100 punctures that we are doing at a particular small area, and through that we are deceiving the body to making it believe that an injury has happened, and the body should produce more healing agents and healing factors, and more stem cells to actually heal the body. So this is the main mechanism behind cupping, and it's generally very healthy.
I mean, we can go on, and we have, there's quite a lot of questions. I think before we'll stop here, but before we end, it'll be very nice if you would like to share your contact details with everyone on the webinar so that they can contact you, or perhaps send an email to your office if they want to get in touch or get some advice.
I can give my contact details is, +91. That's the Indian code, and the number is basically it's of a the management there. It has the number, and then they can route to me. So it is +91 800 6122 this is the phone number, and then my email ID is Ameed Murad. That's my name, full name, without any gap, without any full stop, @gmail.com. So anyone who has any issue and requires any help, I'm all there. I'm all available to help.
Thank you so much, Doctor. I mean, this has been such an insightful session. I'm sure a lot of people have gotten a lot of benefit. May Allah reward you for your service. And yeah, and I think this calls for a follow-up session. We have so much to delve much deeper into. So watch the space. We might come back with more detailed webinars where we delve into particular topics. Doctor, if you're up for it, I mean, I'm definitely up for it, and I'm sure a lot of people here would be up for it. So yeah, thank you everyone for joining us, and until next time.
Thank you,
Thank
everyone. Thank you. Thank you, Sada.